So let's talk about what happens when two of the biggest technologies out there, artificial intelligence and telemedicine, join forces. And I'm not just talking about a slightly better video call with your doctor. No, this is a complete rewiring of how we deliver, predict, and even personalize healthcare itself. I want to start with a number. Just look at this, $157.3 billion. That's what the market for AI in telemedicine is projected to be worth by 2033. We're talking about a growth rate of 26% every single year. This isn't some slow-moving trend. This is an absolute revolution happening right now. So how in the world does a market get that huge that fast? Well, it all comes down to a really powerful partnership between these two technologies. And to really get what's going on, you've got to understand the very specific and very different job that each one does. First up, you have telemedicine. The easiest way to think about it is like a super fast data highway. It's the whole infrastructure, the pipes, that moves a constant stream of health information. We're talking live video, data from your smartwatch, high-resolution medical scans, you name it. It's the thing that basically blows the physical walls off the clinic. Okay, so if telemedicine is the highway, then AI is the brain that makes sense of all that traffic, right? Without AI, you just have this massive flood of raw, kind of useless data. But with AI, that data gets analyzed in real time, spotting patterns and predicting risks that a human just might miss. It's what turns all that information into actual intelligence. So we've got the data pipe, and we've got the brain. But how does this team up actually change what a doctor does every day? What does this new AI partner actually do? Well, it really boils down to 4 key areas. First, making diagnoses way smarter. Second, managing patient health proactively, before things get really bad. Third, creating treatments that are truly personalized to you. And finally, something that every single doctor is going to love, radically improving their day-to-day workflow. Okay, let's take diagnosis. Picture this. An AI has been trained on millions of medical images. It scans a chest X-ray that was just taken at a remote clinic, and it instantly flags a tiny, suspicious shadow. One so subtle it could easily be missed by the human eye, but one that might suggest early-stage lung cancer. That's a game changer. And this brings up a really crucial point. The goal here is not to replace the doctor. The AI is acting like a second reader, or just a really good partner, pointing out things to look at. But the final call? That always rests with the human expert. It's all about making them better at their jobs, not automating them out of one. Now, for workflow. This is huge. Doctors spend so much of their day on paperwork, like writing up clinical notes. Well, new generative AI can securely listen in on a telehealth call and, in seconds, draft a perfect summary for the patient's record. And the impact of that is just immediate. Studies are already showing that these kinds of AI tools can save an average of 3 minutes per consultation. Now, 3 minutes might not sound like a lot, right? But multiply that by thousands of appointments. All of a sudden, you've freed up hundreds of hours for doctors to do what they're actually supposed to be doing, caring for patients. Okay, so we've got more accurate diagnoses, more efficient and less stressed doctors. But so what? What does all this mean for the big picture? How does this tech help solve the massive systemic problems facing healthcare systems all over the globe? It all comes down to achieving what experts have called the triple aim for years. It's this holy grail of healthcare. Can you simultaneously improve the quality of care, expand access to more people, and make the whole system more efficient? For decades, trying to balance these 3 things has been, well, almost impossible. And this is exactly where AI in telemedicine becomes so powerful. It boosts quality by cutting down on diagnostic errors. It expands access by bringing a specialist-level AI analysis to a small rural clinic that could never afford a full-time specialist. And it drives efficiency by automating all that horrible paperwork which cuts costs and helps prevent doctor burnout. It hits all 3. And as this rolls out, we're seeing 2 totally different strategies. In a place like Japan, the focus is on augmentation, using AI to make their existing system better. Think of a company like Yubi, which basically helps patients find the right clinic to go to. But in other places, it's all about disruption. Companies like K-Health are using AI to build brand new, low-cost virtual care from the ground up, completely bypassing the old clinic model. Of course, it's not all smooth sailing. This kind of revolutionary technology comes with some pretty serious risks. And to make this future a reality, we have to carefully navigate a minefield of technical, ethical, and legal challenges. The three biggest roadblocks are data privacy, algorithmic bias, and legal liability. For privacy, we've got solutions like federated learning, which is a clever way to train the AI without ever moving sensitive patient data. For bias, it's all about using diverse data and having regulators audit the algorithms. But the really tricky one is liability. This creates a real paradox. Right now, if an AI helps with a diagnosis and it's wrong, the doctor is often seen as 100% responsible. As you can imagine, that model is a huge brake on innovation. Why would doctors trust a black box AI if they have to carry all the risk? The solution probably means we need a whole new legal framework of shared responsibility between the doctor, the hospital, and the company that made the AI. So, let's assume we can figure out all those challenges. What does the future actually look like then? Where is all this technology heading, and what could it mean for your health personally? The roadmap is pretty fascinating. Today, we've got generative AI handling paperwork. In the very near future, federated learning is going to let us build these incredibly powerful AI models on global data, all while keeping it private. But the ultimate goal, the real sci-fi stuff, is the idea of a digital twin, a perfect virtual copy of your body built from your genes, your medical history, and real-time data from your sensors. And this brings us to the final, mind-bending question. If you had a digital twin, a doctor could test a new cancer treatment on your virtual self to see how you'd react before you ever take a single pill. They could model how a disease might progress in your body and intervene years before you feel the first symptom. So the question isn't just about treating sickness better, it's whether this technology could one day predict and even prevent your illnesses before they even happen.